This afternoon. Now, talk to us about the significance of this study and what exactly it is.
Thank you, Unati, for your time. So the Connect TB study is a unique project that we aim to remove barriers of TB testing in the private sector by providing a simple point of care solution without any additional cost to the patients and the provider. So the intervention that the Connect TB study provides, it gives patients who are diagnosed with TB options to either receive the follow-up treatment publicly or privately. So essentially, us as the Connect TB project, we offer free TB testing of any symptomatic client who attends their consultation via the private practitioner, and we do our testing with the NHLS lab. So, and we also have adherence support for all clients who test positive. The adherence support is done telephonically.
So talk to us about the differences now, so how has this, made the current lay of the land in terms of, diagnosis and obviously the support that you get if you have been diagnosed with TB? What are some of the changes that we will be seeing?
Okay, thank you. So with this study, we have observed that most clients who go to the public, who go to the private sector for TB, for any symptoms, and they find to be symptomatic for TB, they don't have enough additional cost to pay for TB testing. But through the through the Connect TB study, we're able to afford those TB tests for them free of charge. But most importantly, we support the doctors with supplies and also with transportation of those specimens to the lab for testing. We use the Vula app, which helps us to communicate the patient information, the patient results, and any other additional information regarding to the patient together with the doctor. So this study brings a novel practice because we bring a telephonic adherence support where we support our clients. We provide basic information about the TB disease, transmission, treatment duration, and routinely adherence facilitators, they call the patient to check if there are any troubling side effects and provide them with immediate assistance. And also the client is able to send a please call me to the adherence supporter who is assigned to the client at any time, so that we're able to facilitate and make sure that we break the barriers that they might be challenged at that moment. So this is really an exciting milestone that we have seen 5 participants who have completed treatment up to date through the adherence support team, so support program. And most importantly, when we hear the testimonies of our clients, they are very positive. And some of them, though they are diagnosed with TB for the second time, they've emphasized that support through this long-term journey for treatments is really beneficial, and they will really advise for this support to be extended to other patients who get diagnosed with TB.
We know that a report that was released in 2020 showed that there has been an increase in the number of people who actually die from TB. Where are we now as a country in the fight against TB? So we are currently, since we have been affected by the COVID-19 pandemic, as researchers who are investigating or tracking TB, we are really affected because all the achievements that were made, they are being disrupted, especially with the TB symptoms overlap, between COVID-19 and TB. The testing has decreased substantially. It means that we are unable to diagnose clients on time, and also we are unable to put patients on treatment. So with the COVID-19 pandemic, even doctors, they are hesitant to collect on-site sputums because they fear of the increase of the COVID-19 transmission in their practices. So we are really challenged, but with the Connect TB study, we motivate doctors. We have trained them on how to safely collect sputum on site while adhering to the protocol, COVID-19 protocols.
Now, one wonders if, doctors, medical practitioners, who are also fearful of going this route, of collecting samples, how the general public can protect themselves, especially now that we are fighting a pandemic. What are some of the tips you can give just ordinary citizens who have to make sure that they protect themselves not only from COVID, but other illnesses, including TB, particularly if this study, the reason behind it was that people took a long time to go and get tested after they actually contracted TB?
Yeah. So thank you. So the tips that we have, luckily with the COVID-19 protocols being advertised through media and several platforms, it does have some measures that also include measures for TB, like wearing of masks, sanitizing, hand washing, frequent hand washing. There are also some of the protocols that do apply for TB. So those ones are we really emphasize for people to adhere to. And also for TB, TB, sometimes it might take time to manifest, but when we have any flu TB symptoms that are more than 2 weeks or more, or any cough, if you are HIV positive, please seek assistance, because some symptoms, they do overlap with COVID, but we don't want to overlook a TB diagnosis in the meantime, so that we're able to address the issues that we have with TB.
Now, in our intro, we read that the first client in this Novel Connect TB successfully completed the treatment for the TB at the end of October 2021. Talk to us a little bit more about this case. When did the person contract the TB? And also, was it in record time that it was in October? Because one knows that it usually takes about 6 months for one to undergo TB treatment.
Yes. Our first client was was diagnosed in May this year. So she completed her treatment on record time. So she was very excited, and she really expressed her feelings that, initially when we introduced her to the telephonic adherence support, she was skeptical on how is it going to be different from the first time she had TB. But through the adherence support and taking her through her journey, she saw the benefits of having someone to walk you through and someone to check on you on a monthly basis, or if you have any questions, you are able to call back. So this is very an exciting milestone for us as a project, together with our doctors and also the patients themselves. Seeing the patient complete treatment, it gives us motivation for us to motivate doctors to screen more patients so that we are able to diagnose clients on time and also put them on treatment. But importantly is the support, because without the support, TB treatment takes 6 months or more for other clients. But with the support, we are able to motivate the clients and also equip them with problem-solving strategies, so that when in future they become infected with any other illnesses, they are able to maneuver themselves through the healthcare system, because sometimes it might be challenging for one who is being diagnosed with a certain illness.
Now, we know that the project started in May, as you've said. When does it end, and when do you include, the general public, as it were?
So our project is going to end next year, March 2022. So, as Connect TB, we really we are connecting the public and the private sectors, which is a very crucial step, so that we are able to make sure that we reduce treatment. We reduce the delays of diagnosis and also the delays of treatment. But as a public, we will really like all the other sectors to continue, or for us to expand this project to major centers, so that we are able to continue with telephonic adherence support for all clients who are diagnosed with any illness, especially the ones who are on long-term treatment. but most importantly is to walk through our clients the treatment journey so that it doesn't become challenging, as they have expressed that the treatment journey is very challenging. So, and also in terms of the Vula app that we are currently using, we would like to test it with the other public sectors, public clinics, together with private doctors, so that doctors will be able to communicate directly with the public clinics or the nurses at the clinics, so that when a person is diagnosed through the private sector, we're able to immediately link them up with the public sector, who are well equipped for TB treatment and also managing TB clients.
All right, thank you so much for your time this afternoon, Dr. Chibi. Dr. Buyisile Chibi is the project manager there. Of course, the first client in the Novel Connect TB study successfully and timeously completed treatment for tuberculosis at the end of October 2021.